Let's talk about cancer. We all hear that word and, we think we have a pretty good handle on it. It's cells growing out of control, right? Well, yes. But that's like saying a symphony is just a bunch of loud noises. The real story is so much deeper and honestly way more fascinating. So let's dive in and get a real clinical picture of what's actually going on. So let's just start with that one big question. If it's not simply cells growing too fast, then what are we really truly talking about when we say the word cancer? And right here, this is the single biggest shift in thinking I want to share with you. The common view is all about speed, a problem of acceleration. But the oncologist's view? It's about order. It's a disease of failed cellular governance. Think of it like a city where the traffic lights have all broken down. The problem isn't just that the cars are moving, it's that they're ignoring all the rules. So let's really unpack that idea of broken rules, because this gets to the very heart of the matter. Cancer is basically a rebellion that starts from within, and the rebels? They're your own cells. Now, just pause for a second and think about what that means. This isn't like a virus or some bacteria attacking you from the outside. No, these are your body's own cells that have gone rogue. And that is exactly what makes cancer so tricky. Your immune system might look right past them, and our treatments have to walk this incredibly fine line of killing the traitors without harming the loyal citizens they look so much alike. So in a healthy body, your cells operate like this perfectly disciplined society. Every single cell knows its job and follows a really strict set of rules. Rule 1, you only divide when you get the official signal. 2, you specialize, you become a skin cell or a liver cell. 3, you know when to stop. And number 4, this one is absolutely crucial, you die on schedule. It's called apoptosis, and it's a pre-programmed self-destruct to make way for fresh new cells. And the whole entire complex story of cancer, it starts right here, with one single cell somewhere in your body that decides to just ignore the rules. That's it. That's the first act of defiance. Okay, so how does a cell even learn to break the rules? Well, that brings us to what you could call the recipe for cancer. And you've heard of the main ingredient, mutations. But here's the thing. They're absolutely necessary, but they are not by themselves sufficient. This is a massive, and I mean massive, misconception that's out there. If you only remember one thing from this section, please let it be this. We hear the word mutation and our brain just jumps straight to cancer. But that is not how this works. The truth is, mutations are a totally normal part of being alive. I mean, our cells are dividing constantly, and sometimes they make tiny little typos in the DNA. We get exposed to the sun, we get older, all of it causes mutations. Most of the time, our body has these amazing repair crews that fix them, or the immune system just clears out the funky cell. No harm, no foul. The real problem starts when a very specific, unlucky set of mutations hits the exact right genes, and they start to pile up, one after another, in the same family tree of cells. It's not one single car crash, it's a series of unfortunate events, all happening to the descendants of that one original rule-breaking cell. And as all these mutations stack up, these cells start to develop, well, superpowers, bad ones. Biologists call them the hallmarks of cancer. They learn how to grow without any permission slips. They completely ignore the stop signs from their neighbors. They figure out how to resist that self-destruct sequence. They even trick the body into building them their own private blood supply. They're essentially becoming masters of their own terrible destiny. Okay, so that's what's happening on the cellular level. But how does that actually show up in a person? This is where we have to understand the difference between the local problem, the tumor you can often see or feel, and the systemic risk. So the local problem, the tumor, that's the part we usually think of as the cancer. And it's basically a physical pileup. It's just a consequence of cells being born way faster than they're dying. It's a traffic jam of cells that forgot how to follow the rules. And this is so important for understanding why we treat cancer the way we do. That lump is not the whole story. The real danger, the systemic risk, is that these rogue cells can break off from the mean tumor, get into the bloodstream or lymphatic system, and set up new colonies somewhere else. And this can happen really early on, even when the original tumor is still tiny. This is precisely why, when someone is diagnosed, doctors do something called staging. Staging isn't just about measuring the tumor. It's a sophisticated way of estimating risk. It's a clinical tool to answer the big questions. Where is the cancer now? And, based on its biology, what's the probability that it's already somewhere else, even if we can't see it? And that really gets to the core of what oncologists do every day. So many of their decisions are about managing risk, not working with certainties. It's why someone with a small, surgically removed tumor might still need chemotherapy. The treatment isn't for the lump they already took out, it's to hunt down any of those potential escapees you can't see on a scan. It's risk management. So if every cancer is this unique collection of broken rules and mutations, it stands to reason that no two are exactly the same. And that's why the same diagnosis, let's say breast cancer, can be a completely different disease from one person to the next. A cancer's personality, how it's going to behave, is just incredibly specific. It's shaped by everything. The tissue where it first started, the exact genetic typos that are driving it, the neighborhood of normal cells around it. Even the patient's own unique immune system and their general health play a huge role.
And that is why modern oncology is moving so fast towards personalization. It's not enough to just know the cancer's name anymore. Doctors want its molecular fingerprint. They want to know exactly which mutations are driving it, so they can pick a drug that's specifically designed to attack that particular weakness. Okay, so let's wrap all this up. The whole point of going through all this biology isn't to scare you. It's the exact opposite. It's about taking this really scary, chaotic idea and trying to replace some of that fear with clarity.
Part of having clarity is knowing what cancer is not. And this is so important. It is not a punishment. It is not a sign of moral failing or a lack of willpower. It is not caused by one stressful week at work. And while we can do things to lower our risk, it is not always preventable and it's not always controllable. It is a disease of biology.
Which all boils down to this. From a clinical perspective, blame has zero role in cancer care. It's just not part of the conversation. The focus is on the biology of this particular disease and the tools we have to fight it. That's it. Period.
And that really is the final takeaway. Understanding the science doesn't give us a crystal ball. It can't offer us certainty. No one can. But what it can offer is clarity. And with clarity, you can ask better questions, make more informed decisions, and be a true partner in your own care. It's the foundation for navigating one of the hardest things life can throw at you. Thanks for joining me.